Good evening. If you'd like to get started, the buffet is waiting for you now. So please make yourself comfortable and enjoy the buffet.
At the National Minority Quality Forum, we start with data. Over 5 billion patient records harnessed to reveal the hidden stories behind health disparities. Our research leads the way, asking the right questions to build evidence for a healthier tomorrow. Then we take that evidence to the halls of power, shaping the policies that drive change for those who need it most. We unite the brightest minds and most committed hearts, building powerful alliances for impact. We tell the stories that need to be heard, reaching patients where they are and inspiring action on the ground. And on the ground, we partner with trusted messengers to deliver real solutions, from barbershops to faith leaders. From data to action. Together, we are shaping a healthier, more just future for all. Welcome to the National Minority Quality Forum's 2025 Leadership Summit.
Wow. Good evening. Can everybody hear me? Is my mic on? Oh, Lord, I kind of had to figure that was going to happen. Okay, there we go. I was just going to keep talking until it came on. Okay, so good evening.
Good evening.
Okay, clap twice if you're paying attention. That was just to force you to put the food down for a second. Okay, welcome to our town hall presentation and dinner at the National Minority Quality Forum Annual Summit on Health Disparities. Have you been enjoying your time so far at the conference? Yeah, really amazing conversations. And you know, this is a town hall meeting. So that means that we are really encouraging you all to, at some point, ask us some questions. Because we have amazing people on this panel who come from vastly different backgrounds and expertise. And so this is really an amazing opportunity. We kind of drag them here, say, hey, you know, stop what you're doing. Out there changing the world. Come and join us and talk to everybody. So I really encourage you all to think about your questions, write them down if you need to, and at some point, you'll go to one of these microphones and we'll answer your questions. Okay, I'm Adjoa Kyerematen, Vice President of Communications and Public Affairs at the National Minority Quality Forum. And today we're going to be talking about influencing health. And all of these folks come from different backgrounds and are influencing health in different ways. So they're going to introduce themselves, but I'm just going to say a little bit razzle-dazzle about all of you, if you don't mind. So Dr. Jess is a nurse practitioner and an entrepreneur and is from Everybody. And she's really going to share with us from the clinician's perspective, especially, and from her everyday, how she's influencing patients that she sees. We have Alencia Johnson, who is, I mean, what can we say? I mean, she's done presidential campaigns, she's from Planned Parenthood, she has really seen it all, and she has a new book right now, Flip the Tables, The Disruptor's Guide to Achieving Change. I mean, isn't that very apt to our conversation tonight? Okay, so she's gonna say, well, you know, from all the things I've seen, how can we apply this to the work that we do? And then we have Joel, Dr. Joel Wervel, my Ghanaian brother, okay. Who has become what? The health myth buster, well known on social media and in halls of power, using his platform to combat misinformation. And then we have Layton Thomas, mom and founder of Mama Glow, where she saw a problem and started a movement to train doulas and then has used that learning and insights to impact payers, providers, everyone that you know. So we're going to start with you, Latham, because I think that your story is so interesting in that you know, in a way, you were an everyday mom and you saw a problem, and in your years of Mama Glow, what made you decide that, okay, I'm going to go from training doulas to taking those insights to influence policy and care delivery? What was the turning point for you?
Well, first of all, can people hear me? Okay, here we go. Thank you. Thank you so much for the opportunity to be here and with you all this evening. I'm Latham Thomas, founder of the Global Maternal Health and Education platform, Mama Glow. We service doulas and nurse care managers through a market-leading training program. We've trained 3,000 doulas globally since 2018, and then we develop trainings as well as workforce development pathways for doulas and nurses as well. And so for me, starting out as a doula, you know, over 2 decades ago, I've been like in women's health for like 25 years. And so in the beginning, like there wasn't the sort of understanding of what doulas did, the importance of their role within the care team. And so for me, it's always been really about increasing awareness and access, and through that, the education is really important. And creating what we call the birth village really depends on also people who are part of the provider team understanding the unique role that doulas can play. And this is really an ancestral role. This has been a role that's been embedded in community, and so to bring it back into this, in clinical settings where it's respected is really important. And so when I was doing the work, I was able to see some of the gaps, right? And use that to help design ways to meet those gaps, but then also see like where we have policy as well as policy gaps, and then also, you know, pragmatically speaking, going into hospital spaces where there's also just like a lack of understanding and a lack of respect for the role that doulas play. So a lot of the work that we did was improving communications and creating programs where doulas and nurses, as well as other members of the care team, can connect. We designed doula navigator programs for hospital systems in New York City and beyond. We designed the very first doula benefit for the nation's leading insurance company, which is in its second year, and it's servicing 2.2 million federal employees actually. And so all of that is possible though because there's like an awareness. And so a big piece of the awareness building that we did was through digital advocacy. So through our digital advocacy efforts, we've reached 10 billion people. And so
I want you to say that number again. How many people did you reach?
10 billion.
Oh my gosh.
The digital advocacy, which makes it possible for us to have these conversations, right? Which makes it possible for people to go into rooms where health funding is being decided, right? And deploy it in the right places. It's also bringing this work into academia. And so we were the very first doula training actually brought into the Ivy League, where I was appointed as a professor at Brown University. And I teach bioethics students, medical anthropologists, OB-GYN, public health, as well as pre-med students. And they take this work, this academia-based work, right, into their pathways to improve maternal health outcomes. So for me, it's like, you know, we have to touch all of it in a multi-pronged approach, right? And so academia is one pathway. Obviously, like insurance is another pathway. You know, thinking about like within the care team, how we affect like within the hospital or birth center home atmospheres, those are also a pathway that we have to think about. Mm-hmm. And so we're just really about touching all of it in the way that we can and bringing solutions.
That's amazing. Great. I'm gonna jump to you, Alencia, because, you know, in your campaign work, and sort of you've worked with policymakers especially, but you've also been an advocate. What lessons have you learned that you think can be applied to public health right now, particularly in this fraught time where there is a lot of uncertainty in healthcare? What lessons have you learned that you think can be applied?
Yeah, thank you so much for having me here. I'm really excited to be here. You know, I think about two things that I talk about a little bit in my book, and also it's been kind of a thread through of my career, working on presidential campaigns, working at Planned Parenthood, and now having my own social impact consultancy is one, truth-telling, right? Myth-busting, just being the voice that actually shuts down the mis and disinformation. I'm thinking about, as we were preparing for this panel, I was thinking about, I do some commentary on CNN and MSNBC, and I had to go on with Scott Jennings one time, and right?
You're the in the room.
You know, sometimes I really don't feel like arguing with him, so I just make a face, and I'm like, you know what, you got it. But they were talking about, it was around the time when folks were paying attention to the gutting of the CDC, and as we know, with bird flu here, right, with these unfortunate children who have died from measles, preventable deaths, right? Yeah. And I had to just mention that, right? I said, oh, because Elon Musk is doging the government and all of this misinformation that's out there and this culture that has really actually started to question and shun expertise, right? Like medical expertise, scientific, like how are we in society questioning medical experts, doctors and researchers, right? And so I connected the dots of this is the reason that a child will lose their life and has lost their life to measles, and their parents are saying, well, that was the sacrifice for the government that had to be made, right? Like the things that the child's mother said and also did not regret not vaccinating their child. Again, that's a cultural thing, which I'm gonna get to in a second. I had to be a truth teller in that moment because, and I had to connect the dots for people listening. Elon Musk is the reason that we're here, right? Like connecting the dots when people say none of these things are connected when, yes, they are, right? There's a ripple effect, and then I have to be a truth teller. And Scott Jennings and I went back and forth. He put words in my mouth, and I was like, that's not what I said, bro. You're not gonna put words in my mouth. I'm really talking about what is happening with measles and the fact that this was eradicated, but now because this you know, culture of anti-vaccination has grown in this country, unfortunately, we're going to see more. You all know this better than I do. We're going to see more deaths of preventable illnesses. So being a truth teller in those spaces, and yes, you all are obviously having these conversations and your industry at work, but it's those conversations that have to be had with your family.
Yes.
You know, in all of my political organizing, I realized that, oh, I can talk to thousands of people on stages, I could talk to people on television, but shifting the minds of your family and your friends, like we like to stay away from that. But that's actually where we can be, as the title of my book, The Everyday Disruptor. That is where you can be an everyday disruptor and actually have meaningful impact because you are a trusted voice in your family and in your community. And so how do you know, be that person that fact checks all of this? The other piece too that is really imperative, we're talking about culture and society, storytelling. And again, I've done a lot of work with surrogates and entertainers. I've worked for President Obama's re-election campaign, Senator Elizabeth Warren, the list goes on and on, Vice President Harris, and we've had a lot of like A-list celebrities and a lot of well-known congressional members, all these people who are out here talking about issues. But what really moves the needle on folks are everyday people who tell their story. When I was at Planned Parenthood, the most powerful storytellers were the women who were brave enough to tell their abortion story. The women brave enough to talk about how they had a near-death experience giving childbirth, but thank God for a doula, thank God for interventions. They were able to tell their story, and that shifts people's perspectives, right? It helps them understand and experience. And as I say in my book, storytelling doesn't cost any money. It just takes a lot of courage, right? But if more of us continue to be storytellers, yes, you got Ryan Coogler and Ava DuVernay who do amazing jobs, right, with their platforms, but it's the everyday storytellers. It's the reason that, for the most part, we could, I mean, you know, they're threatening it now, but I think about the Affordable Care Act, right? The reason that people started embracing it more was because people were talking about how the Affordable Care Act was saving their lives. I'm an entrepreneur. Thank God for the Affordable Care Act. I can get my own health insurance, right? And it's those everyday stories that really impact people, and especially right now, as we see what's happening, not just in Congress, but in a lot of state legislatures, we've got to connect that policy to the real life implications, right? The fact that I'm having conversations with my parents, my mother is a breast cancer survivor, as well as a heart patient, and I'm like, oh, okay, your insurance, your Medicare is actually threatened right now. So like, what's the conversation that we have to have as a family? Right? And so sometimes we like to talk in abstract numbers and data, but we actually have to talk about these very real stories. We have to put a face to the impact. And so storytelling and truth-telling are the really key pieces of advocacy that all of us can do, and you all can do in your positions every single day.
You know, that's a perfect segue to talk to the doctors, because I think both of you are communicating in different ways. So Dr. Jess, I'm going to start with you. You know, as Alencia said, the conversations you have with families, the conversations you're having with patients, what does it look like for you on a daily basis, communicating with your patients to impact the decisions that they make?
Right. Again, like everyone else said, thank you for having me here today. I currently work here in DC as a cosmetic dermatology nurse practitioner in aesthetics and the wellness space. And I think for me, as you mentioned, it's pretty much like storytelling and really just showing up and being empathetic and being cultural competency for my patients. It's me just being there and educating them. I think when it comes to skincare and aesthetics and wellness, a lot of people don't know. They know what they know. And as a provider, one of my main goals is really just educating. I think educating is basically the root of everything. When it comes to aesthetics, I talk about skincare, I talk about, you know, anti-aging, different modalities, different devices that we do use, myths, Botox, filler, all of these type of misconceptions that sometimes one may think is, you know, frowned upon, especially in the brown and Black communities. So for me, it's more so just going on social media, using my platform. As a former NFL cheerleader, I started as a dancer and kind of had to work my way from the bottom to the top in nursing as a doctor of nurse practice. So I really just try to do my due diligence in representing myself, not just as a former artist, entertainer, but now as a provider and a Black provider here in the DMV, DC. And I would say now you know, with storytelling, my patients, they will advocate with me. They will collaborate on social media and share their stories and talk about, you know, laser treatments, Botox, anti-aging, and wellness. I'm in the process of merging into entrepreneurship and doing more so wellness and like Pilates and kind of merging that in and what that looks like. And I think for me, when it comes to healthcare, it's kind of like a comprehensive situation. Your wellness starts from inside out. So it's my job to really just kind of just lead people into a healthier lifestyle. It starts with the gut, and that kind of helps with their skincare and their overall well-being in their care. So for me, storytelling, just being a leader in my community, and really just showing on my social media platform what that looks like, and really just helping with the misconceptions when it comes to, especially aesthetics, I feel like, especially right now in this time and age, a lot of people are kind of afraid of aesthetics, or they look at it as a luxury. But I think as a woman of color, me just being in these spaces is already showing, me being visibly in these spaces is already advocating that we can be in these spaces, and we do matter. And taking care of yourself is a luxury, and it's something that is a part of healthcare. I think most people think that healthcare, when you think of healthcare, it's, you know, it has to be insurance-based, or it has to be more so like diabetes, heart, things like that. I think that aesthetics is also a part of your self-care and your healthcare.
Well, Dr. Joelle, when it comes to Dr. Jess talked about misconceptions all throughout her remarks. When it comes to combating misconceptions, you're like, what, Captain Planet? Right? Tell us a little bit about this journey that you've been on. You know, did you know that this was what you would be doing on such a consistent basis? And why do you think that you've really broken through with your platform as far as addressing myths in healthcare on a consistent basis?
Absolutely. Well, like everyone else said, thank you so much for having me here today. For those who don't know me, my name is Joel Brevel, recent medical graduate, starting residency in a few weeks, which feels crazy. But I'm better known online as a medical myth buster for creating videos where I try and combat hidden medical history, understand health inequities, and really help our communities understand the ways medicine needs to change or hasn't included us in the past. I really started on social media about 5 years ago now, 5 to 6 years ago. And it began because I went to Washington State University for medical school. And when I got there, I found out that myself and one other student were the first 2 black students to be at our school. I have to caveat that by saying that our school had only been around for 4 years. But despite that, there'd still been 300 students, none of them black. And so when I got to school, I was constantly thinking about what it meant to be one of the less than 6% of black physicians, or joining the ranks of the 6% of black physicians in the United States. And I kept not seeing myself represented, especially when, in 2020, the COVID pandemic hit. But I remember there was one day in particular where it made me realize I had to speak up a little bit more. We were talking about cyanosis, which many people here know is when the skin turns blue. I remember looking at myself and saying, I'm not gonna turn blue. What's gonna happen to someone like me? And I turned next to me to my friend Cameron, and I said, should I ask this question? He's like, yeah, you definitely should. Like, I don't know the answer to it. So I rose my hand, asked the professor, and he had a great answer. He said, you can look at your mucous membranes, you can look at your eyes, you can look at your nail beds. There's all these different ways to be able to tell cyanosis and with someone with darker skin tones. But one of my peers came up to me afterwards, and she said, if you hadn't asked that question, I would never have known that. And it made me start thinking, when is the first time she would have seen a patient with that condition? Would it have been when she missed it? When a baby died because of it? And so I really wanted to better understand how can I be using my voice, even as a medical student, to talk about these issues. The opportunity came in December 2020 when I was online on Instagram and saw this article about this device that many of us know about called a pulse oximeter. It goes on your finger and it measures what's called your blood oxygen saturation level, essentially how much oxygen is bound to your red blood cells. The New England Journal of Medicine study was shared by one of my friends in just a story post, and in it, it said that black patients are 3 times as likely to have inaccurate, overestimated oxygen saturation levels when we use this pulse oximeter. I remember sitting there reading this in my bed. It's December, I was home for Christmas break, and saying, how have I never learned about this? I'm in my 2nd year of medical school at this point. I've done my pulmonology unit, my cardiology unit, and we've never talked about this disparity. And I started thinking about how during the COVID pandemic, that would have real world impacts, where the FDA was telling people that they should be buying a pulse oximeter, putting it on their finger. But that means that if the pulse oximeter is overestimating oxygen saturation, that means someone could have low oxygen levels, go to the hospital, it reads incorrectly, and they get sent home when they shouldn't have. And so I did what any Gen Z/millennial would do, and I took to TikTok. And at the time, you could only have 30-second videos on TikTok. And so I started off the video by saying, what does racial bias in medicine look like? And I talked about the exact problem I just laid out with the pulse oximeter. Within 24 hours on TikTok, that video had over 500,000 views. And most of the comments were from doctors and nurses and other healthcare practitioners that were saying, I never knew about this. And I've been using this device on my patients every single day without even realizing that it may not be working well on their skin tones. And it made me realize that there's all these different ways that those biases exist in medicine. And so my sister, Rachel, she's a medical doctor as well, I ran to her room and I said, Rachel, look at the conversations that this video is starting. And she's like, that's great. Did you know about all these other disparities that exist as well? You need to talk about these. And so one of the next videos I made was about the GFR equation, which I think many people here may know. But if you don't, I'll tell the story really quickly. But GFR stands for glomerular filtration rate. It's a function of how well our kidneys work to filter out toxins from our body. If you have a high GFR number, your kidneys work well. If you have a low GFR number, your kidneys don't work very well. Well, for decades, there had been a racial correction for this GFR equation that essentially said, if you are black, and only if you're black, we're gonna overestimate your GFR number by adding a multiplier, essentially saying that all Black patients have better kidney functioning than any other race, simply because we're Black. When you went back to the research to understand why, it was built off of a false belief that all Black patients had higher levels of this muscle breakdown protein called creatinine. And so they were trying to adjust for that by including this equation multiplier. But what that ended up doing was making it harder for Black patients to be able to get diagnosed with chronic kidney disease, to be referred to kidney specialists, and to also be able to get kidney transplants. In 2021, a group of physicians, I always say Black woman physicians, stepped forward that were nephrologists and said, we need to change this equation. And they went up against the board and said, we're gonna make a difference, we're gonna make a new equation. And thankfully, a new equation that no longer included race was created. In 2023, the Organ Procurement and Transplantation Network essentially said anyone that has had this GFR equation used, we're gonna retrospectively go back and we're gonna correct their wait times. To date, between 10 to 15,000 Black Americans have had their wait times adjusted.
Wow, that's influence.
And so during this whole time period, I was talking about issues like this, and unfortunately there's a lot, this would be a whole conversation about race-based medicine, which I won't get into, but unfortunately there's so many other examples like that. But I've been creating videos on social media, on TikTok, Instagram, LinkedIn, you name it. And a woman, her name was Anise, had been following me for years, and every time I posted about the GFR equation, she would share that video with her sister who had chronic kidney disease. And when I posted in 2023 that her sister could potentially be moved up on the kidney transplant list, she gave that video to her sister took it to her doctor looked into it, found out it was real, and she was able to get moved up 5 years on the kidney transplant list. Wow. All because of seeing a video on social media. And so last year, it was really cool because I had the opportunity to be on the Kelly Clarkson show, and they actually surprised me by bringing on Anise to talk about what that meant. And what I didn't know at the time was that her sister wasn't there because her sister had just received her kidney transplant the week before. Wow. And so it was a full circle moment in all these things. But I tell those stories to show how the main thing here is education. It's the storytelling that we've been talking about. It's making sure that patients have the education from us, but it's putting it in a format and in a place where people are naturally receiving information already. 1 in 10 patients get their information from social media, but most doctors don't even know how to use social media. I grew up with it in this generation, so I got lucky. But that, for me, it's all about making sure that I continue to use my voice in a way that approaches my generation, but also different generations. And so you asked if I ever thought I'd be doing this. The answer is absolutely not. Like, I never thought I'd be using social media. And the other day I was looking at my analytics online, and every month I'm reaching over 15 million people across social media on different issues, all talking about health equity, health inequities, the things that we need to do. I think this is the last story I'll tell, but there's this one moment where I was at Student National Medical Association, their AMEC conference last week, and a girl came up to me, and she was a first-year medical student, and she said, I went to medical school because of you. And I said, well, how's that possible? I feel like I'm not that old yet. And she was like, well, I was a senior in high school when you made your pulse oximeter video, and I saw that and said, I need to be in medicine. And so fast forward 5 years, and now she's a first-year medical student about to finish. And so once again, social media has the power to change lives, to inspire others. And I've always said that the Black community, we've always found spaces for our voices to rise when traditional media doesn't tell our stories. I think today, that's what social media represents.
Yeah, that's amazing. Thank you so much for that. Okay, a common thing that we've been hearing so far at this summit has been that, wow, when I'm talking to others, I'm finding some hope right now in what many say is a challenging time for advocacy, a challenging time for communicating, a challenging time for delivering care, because there's a lot of noise. So we're going to talk about challenges and we're going to talk about solutions. Okay, so first I want to ask all of you, what in your view, in your everyday, has been the #1 challenge that you feel either that you're experiencing or have seen or that we are experiencing as a society in trying to communicate and deliver change? So anyone want to start or should I? Okay, Dr. Joel?
Yeah, you can go. I'll go after.
Okay. No, I mean, the first thing that pops into mind, you mentioned this, misinformation and disinformation. And for those who don't know the difference, misinformation is just wrong information that's put out there that's perpetuated. But disinformation is a huge problem. That's intentional information that's wrong to lead people in a different way. I think the measles outbreak, as you talked about, is one of the best places. But I think we are literally in a misinformation and disinformation age, where people can pay individuals, and this is all from the behind, people can pay individuals to say things online that are not true because it helps someone else's bottom line. And that is quite literally happening behind the scenes through political PACs that are paying different influencers or trusted voices to mislead people. And so I think when I think about like this entire environment, so much of it could be prevented if we taught people how to actually spot and combat misinformation and disinformation in a better way, and that we actually trusted people that actually are experts in their field and know what they're saying.
Right. Latham?
Yeah, I mean, I think like funding, I think that there's organizations that are doing such incredible work and they're anemically funded and they're doing work in the community and are really close to where the problems are. They need the funding to do research. They need the funding for quality improvement. They need also coalition, right? And so institutions need to partner with community-based organizations and actually give them the funds to deploy the services and the solutions. And so I think part of it is really looking at Black female-led and POC-led organizations and enterprise that are problem solving. I think it's also investing in science-backed solutions as well, and people who are sort of doing things that are on the frontier that are in the health equity but also tech-witty track, right? And then I think it's also like investing in the future. I think about young people all the time. So much of our work is focused on looking at people who are going to come up behind us. And so it's investing in the young people who are in the universities and coming out and who have like all the energy because we're older. Like we need the young people, right? Who have that energy and the tenacity and the fervor, but who also can like be on the front lines and solve problems. So, but I think we need money. It needs to be funded. And so I think with all we're seeing that's happening right now, like on a federal level, a lot of these cuts, like we have NIH grants and HRSA grants, they're protected, our money's allocated, but we have other contracts where we have a doula contract, right, with the federal government that people who got doged, like we found out that like so many of them were having babies and they were calling because they didn't have insurance to actually cover their births.
Wow.
Right? And so things like this really impact people, and it's not just on an organizational level for us, it's like on a human level, right? Like we're finding that through the storytelling as well, like you have individuals who are sharing that there's things that are happening that could literally be avoided if people actually knew. And so I think with our media as well, social media is a powerful tool. But also we need traditional media and linear media to also platform these stories, to also lift up what is happening. And I think that this can also be a story that's told in a nonpartisan way, because when people start to see that a child or a mother or just an individual is going through something that could have been prevented or that was caused by like something that is happening like outside of their control, that is being mismanaged, everyone can start deploying their energy to try to fix that, right? Or meet those gaps as well. And so I think funding is one of the biggest pieces, and I think a solution for that also is coalition building. I think that we have to come together. Like everybody's in this room right now. Like the solutions are right here. Right. You don't have to go. You don't have to go any further. It's like right here in this room. There are people here who can solve problems that you currently have within your organizations. Right. There are people who are in this room who have been solving problems. Right. And people don't even know because that work is not being amplified through communications, right? Because it's not sexy enough or whatever, right? And so we need to really look at, who's next to us, right? That we can join forces with and build, because that's really the only way we're going to get through the next 4 years, honestly. We have to come together, we have to work together diligently, effectively, and also use the power that we have in our arsenals and come together and see, like, what do I have that you don't? And like, let's come together. What do you have? Oh, we don't have that yet. Bring it over here. and do it like we used to back in the day. You know,
Right.
I think about, you know, when we were coming up, when we were younger, like everyone shared, right? And now everything is like siloed, and people don't like to work together because they need credit. But we need to get to a place where we are coming together, building coalition, creating networks that are powerful, that can help to tackle what is ahead of us.
Right.
Because otherwise we don't get through alive.
Yeah.
Let's get real. Alencia, you know, Latham's talking about using even traditional media channels. She still has hope in traditional media. That's wonderful to hear.
Not hope, I'm just saying use it. Not hope.
You know, Joelle is talking about the massive amounts of misinformation from your seat, especially. You know, how do we disrupt, okay, the current situation, you know, with communications, whether it's social or traditional media? How do we break through, in your view? What solutions could we be doing in order to affect change?
Yeah, you know, they both actually touched on some things that I was thinking about, which means that like these are the solutions, right, to the issues. When it comes to media, I'll be honest, like I was telling someone the other week, I said, actually, last week I was on the Breakfast Club, and they were asking some questions about, you know, why certain leaders of certain parties aren't doing enough. And I said, well, unfortunately, when I'm on cable news for a whole hour, they only want to talk about what's happening in the White House versus the 435 members of Congress, the 100 members of the Senate, the 50 governors, and so on and so forth, right? And so there has to be a little bit of self-accountability and like us understanding what's happening, but then also understand that cable news is a business. Right. And how you generate revenue is views and clicks. You get that by entertainment. So unfortunately, you're not gonna get these stories that, I wish we had those stories, right? I actually wish that, I was on a segment last week talking about, you know, that plan for more women to have more babies, and I was sitting there like, oh my God. And then it like dovetailed, and like the men on the panel were the ones talking. I was like, I'm the only one on here that has worked in reproductive health care? Like, but nobody wants to talk to me about this. Y'all wanna have these other political conversations. And so with that, I challenge us, very informed people here, to understand that the overwhelm and distraction, those are tactics to get us to not be clear-eyed about what is happening. Those are tactics of an oppressor, in an oppressive system. And so if we can't get from some of this media what we need, we've got to have a good media diet, right? And like, read some papers, or watch your local news that still does it starts with the doom and gloom, and it leads all the way through into hopefully a nicer story, but you will get some of these very real stories. You will get those experts, right? Some of you will probably be on local news, and that's really important. It's also great, I think, to this point that you were making about the information on social media. I was at this, I was talking to some executives at TikTok, and they were talking about how people use the TikTok search engine for medical information the way that they're using Google and WebMD. And not just young people, people across all age groups. So that tells me, as I look and see a whole lot on TikTok and Instagram and all of the social media sites, we actually do need more providers. And I know that folks are like, oh my God, no one's gonna pay attention to me. But even if it's 2 people that you've been able to correct the misinformation and disinformation, that is extremely helpful, especially as I think about, you know, elderly people or folks who don't have as much access to information, but they have their phone. Right. And they're able to, the amount of like distant family members that call my parents and say, can you ask Alencia about this video I saw on TikTok or Instagram that was shared in some group chat or whatever? And I'm correcting the record. So it's getting to people. And so don't worry about audience. I need more of you all who actually know the information to be out there. And then that does pull the views from linear, because what happens on linear is that they want a viral moment that goes on social media, right? And you can respond to that with, this is actually what's happening. This conversation about what's happening with The CDC, HHS, all of those things, people don't understand. They're only paying attention to RFK Jr., but that's an opportunity for you all to talk about, hey, did you know that the cuts over here are impacting this piece, this funding for this research that disproportionately impacts Black people in rural areas, right? Like, that is the type of information that people are craving. And the last piece too, this is broadly, you start talking about this, how we are in these silos. Isolation is the thing that is actually going to be the detriment to us. It's going to kill us. I live in a new building, and I say hi to all my neighbors, and some of them barely want to speak to me. And I'm like, if we can't speak to each other, how are we going to find these solutions that, to be honest, right now it's going to take a lot of community interventions. And if we're not able to talk to one another, if we're not able to put our phone down for an hour and actually have a conversation with someone about what's happening, we've already lost. But that's what those who want to maintain power, and maintaining power actually happens when they keep the majority of people sick and then without good jobs, sick and poor and hungry, without homes. That's what they want. And so in this room, you all have the solutions to do that. And while we have to remind folks too, as we're talking to patients, one of the things that we did a lot of work around when I was at Planned Parenthood, and they still do, is helping patients become their own advocates.
Yes, yes.
Right? Returning the power back to patients.
Yes.
I grew up in a very matriarchal family, so I was always telling my doctor, no, this is what I'm feeling. Like, I didn't have a problem advocating for myself. But so many people do. So many like well-informed, like friends and colleagues of mine, I'm like, you can't ask your doctor X, Y, and Z. So if well-informed people can't ask their doctors anything, what about people who feel as though they're getting the wrong information, or their doctor is practicing from an older study, right? You could actually be the intervention there. You could be the person that goes with a patient advocate. You could be the person that really teaches folks, this is the checklist that you have to have when you're going and talking to your provider. And so all of those things, I think, start to break through the noise as, you know, listen, I'm on cable news. I don't even watch cable news that much because it is such a distraction. And to be honest, you're not getting the information that you need. But you all can literally penetrate what is going viral by actually speaking the truth and unveiling so many other things. So we're like overwhelmed with the shock and awe, like of which one of the Eagles players went to the White House and who didn't. But meanwhile, what is happening in all of these agencies, not just here in DC, but also in our states too. What's happening when they're not accepting funding or not getting funding, or the bill has been hung up in their state legislator for multiple years. It gets introduced every single session and it's still hung up, right? So you all have to think about those ways that you can really distill this information to folks who really need that in a quick way that penetrates and redirects the attention from what is going viral, but actually is not helping our communities, it's actually harming our communities.
So I want to reiterate a few comments you all have made, because I want to come to you, Jess, about this, where we're talking about, okay, there's a lot of noise. Traditional media can't be trusted all the way. And so social media can be used to disrupt the conversation on traditional media that clinicians need to get on these platforms, because that's the platforms that people are using to find medical advice. But Jess, you said something really interesting earlier, and I think that dovetails from what Alencia was talking about. You said the word, I collaborate with my patients using my platform. So what you're suggesting here is that this isn't a one-way conversation, right, when you're using social media. I think a lot of our organizations, you know, can admit, right, we're posting, right? We're posting on social. We're hoping for a like or two, maybe a retweet. But you are engaging with your patients using social media. How are you doing that? Can you walk us through?
Right, so I think speaking on like, you know, leadership and speaking, I think boldness is what we need. And I feel like that's kind of like the conversation that we've all been speaking about, is that sometimes you just have to speak up and be bold about your topic. It might be uncomfortable, it may be a little risky, but sometimes we have to shake the room to get an attraction. And for me, I think that I use my patients and I show them to advocate for themselves. And now social media has this really cool platform where you can collaborate with your followers or whomever. So instead of my patients posting their own point of view and then me posting my own point of view, I have them just collaborate with me, and we reach my platform, they reach their platform, and then we come together, and it's reaching people who they know and who I know. And then sometimes, it's information that, as you mentioned, the misinformation is information. And by collaborating, they're learning more from my page, just simply about healthcare. And then they're collaborating from the other side, the patient's page, from another viewpoint, essentially. So I think oftentimes we have to collaborate with the community because they're the ones that are helping us use our voice. So I think, us being providers, some of us, it's our goal to mentor. Mentorship is important. I think not everyone, this new generation, everyone wants to be an influencer. However, we still need, clinicians.
Yes.
We still need policymakers. We still need journalists. So I think it's also our job to really mentor people and go out into the schools, out into the community, and remind them that education is still key.
Yeah.
We still need these careers to be able to live on, be able to save lives and do other things, because at the end of the day, not everyone can be just a social media influencer.
Right.
You should use your platform, but continue to, go back to school, get an education, and collaborate with your families, your patients, and whomever.
Okay, so we're going to do a lightning round. So I'm going to challenge you all to try to answer this question in like a minute. But when we're looking at this health system right now, the many say are broken and is fragmented, and unfortunately may be under a lot of pressure right now with a lot of change. What do you consider to be low-hanging fruit that anyone in this room, or from what you've seen in your own position that you've been able to accomplish, that we could change the system? What is low-hanging fruit that we can accomplish? So I'm going to do a lightning round. I'm going to start with you, Latham.
Okay, I needed more time to think about this. What I will say that I think is important is that diversity, DEI, I know it's like a word that people cannot say. We have to say it, but not only that, we have to make paths forward for people coming up behind us. We have to protect our ability to advance, to create upward mobility for our communities. We need to see doctors who look like us. We need to see clinicians who look like us. We need doulas who look like us, and so and who come from diverse backgrounds. And I'm really actually terrified of what it means if we are in spaces where we do not see a diverse group of individuals. I'm really terrified of what it means for care, what it means for health outcomes writ large, and what it means for our future. And because a lot of us were on the other side, so like we're not as impacted as the people who are coming up now, and the young people, children, and also what it means for opportunity. I think about what it means for economic mobility in our communities, what it means for how we change the future of our financial trajectory and what we can give back to our communities, how we can advance. And so I think it's really important to find ways to build solution that we design differently inside these spaces where we can make change, where we can design something that's called something else, but is what it is, right? So find a way to move undercover. Find a way to move undercover and ensure that you're protecting the people who don't have the opportunities that we had, that we actually took for granted. And I think now it's important more than ever because literally this is about a future of our own design. And I often think about like some of our literary ancestors like Audre Lorde, and I think about Octavia Butler, who invites us to think about Afrofuturism and what it means to design a future that is beyond this, right? Beyond what's conceptual, but really something that leans into our African ancestral technology, what we remember and what we know is possible. Like, we have to live into that type of design for the future, because everything is being dismantled and we're watching it happen, but there are certain things that they cannot take away from us. And we know how to build things and we know how to design things that if somebody tries to take it apart, they won't even figure out how to unravel it. And so that's the invitation, right? It's for us to be really intentional, be really thoughtful, use our ingenuity to advance, but also we have to think about the future, right? Because a lot of us won't be here, but people will be stepping behind us and they'll be living into a design that we were responsible for. And so I center DEI as just a way to think about that, but there are so many things, right, that we need to protect right now. And so I want you to think about what's closest to your heart that needs to be protected, and to do the work that you need to do in community in service of that, and continue to do it until there's nothing left to do.
See, and that was the low-hanging fruit? Okay. Maybe we have too many visionaries on this panel. Okay, Joelle, what would you say?
Yeah, I think for me, it comes back to one of the things we've all talked about, which is storytelling. That we all have a story to tell, and to tell that story, whatever way seems appropriate. A few weeks ago, I was speaking here in DC for National Public Health Week, and there was a lot of students who had been laid off from the federal government, and they kind of asked a question similar, but in the way that said, I have no idea what to do now. I feel like there's so much misrepresentation of what I was doing in the federal government. I came in wanting to help out. I've been here for literally 3 months, and I've been suddenly laid off. I have nowhere to go. And what I tried to tell them was, tell that story. We need more people to understand that story. The best way to break through misinformation, disinformation is with truth. And truth, it comes from us each saying, here's what happened. Here's why I was working in the federal government. Here's the work that I was doing on maternal mortality, to understand how is this impacting different states, or how the numbers are moving, a group that's now been dismantled, right? And so I think the more we're able to tell our own truth and stories in whatever way matters. I know we've talked a lot about I've talked a lot about social media, but there's other ways to do that too, whether that's op-eds, whether that's speaking with reporters or journalists, podcasting, whether just having those conversations with our family members. Those are all ways to be truth tellers, to break through the noise of what's going on, and to make sure that we recenter what matters to our communities. And so at the end of the day, I always come back to stories. And when I was growing up, my parents are both from Ghana, West Africa, and we talked about Anansi the spider. And so I think, like, even in my own life, stories have been so powerful in driving what I do. I think the entire Black community stories have been so powerful as well. So that's what I'll say. The easiest hanging fruit is tell your story.
And to Latham's point, that's one thing they can't take away from us.
Absolutely.
Right? Valencia?
I mean, they took all of mine. We're all on the same page. Clearly, we're telling y'all, tell your story. And this piece about, you made me think of, tell your why. Not just a patient story, tell why you got into this profession, because this piece that you were saying of how we still need clinicians, we still need doctors, we still need public health experts. I was with a group of Black doctors over the summer, and they were concerned about the medical school enrollment rates across the board, but especially among the future of Black physicians. And so your why is just as important, because everybody I know who gets into this, whatever, from the advocacy space to the clinician space, whichever it may be, there's a personal story, right? Like, you got in this profession to find a solution, to be the solution. And as you tell that story, and this is, as I put in the book, so my book is in 3 sections: disruption of self, disruption of vision, disruption of community. And it starts with disruption of self, because you have to be courageous in order to shake the table, or flip the table, as the book is called. And courage isn't the absence of fear. It just knows that there's something bigger than my fear that keeps me going. And so where is your courage coming from that's gonna build that confidence for you to tell your story, for you to do the thing that you say, you know what, I'm gonna write this op-ed, and if only 10 people read it, it's not a failure. Those are 10 people that I had the opportunity to talk to, right? It gives you the courage to really get out of your own way, knowing that what I have to say is extremely important. And then it goes to disruption of vision. And this is some low-hanging fruit, I think, for me, to build upon what was already said. I do media trainings as well, and I talk about the power of reframing our language and just shifting narratives, right? And from, for example, instead of calling someone, you know, a poor person, someone who's experiencing economic hardship. Because then they feel as though they can come out of this, right? It is not just an identity that they can't come out of this situation. There's solutions here, and it's not their entire identity. And so as I think about reframing conversations, everything's being burnt down right now. And it is very scary. And there are going to be a lot of lives lost. And we do need the immediate interventions that help prevent some of the harm, right? Or reduce some of the harm. But I also look at it as an opportunity to not rebuild, to actually, to Latham's point, build something that is going to work for us. And if we started to be the ones that have that conversation of, yes, it is dark, yes, everything's being burned down, but look at what we can actually build, us together, this coalition, this multiracial, this multi-generational, because this coalition has to look diverse, right? In order for us to create the solutions that's going to work for even more people. And then hundreds of years later, we won't be in this situation, or this nation won't be in these situations of it being burned down. We have to be those visionary leaders who have this radical imagination that say, you know what, yeah, it looks dark, but I've got the solution. I was asked this question about the overturning of Roe v. Wade. And I was like, yeah, there are unfortunately people who are literally dying because of access to healthcare is no longer there. And yet, how Roe was built, it wasn't actually bulletproof. And so now we have an opportunity to center the most marginalized in the solution. And so if we can figure out a way to talk about how we're navigating through this as the opportunity that is actually going to have more people at the table, right? I talk about flipping over tables because at a certain point, those tables don't even work. Like, don't even push your folding chair up into it. We need a whole new table, right? And so how do we build that new table, and what does it look like? And so that's some of the low-hanging fruit. And it feels big and audacious, but I promise you it's not. If you just have a conversation with the person next to you, I promise you it's not that hard. And so that's what I see as the low-hanging fruit.
Thank you. And just bring us home.
Yeah, so I think the first step is realizing that our power is knowledge, and power unused is power lost. So I think that, as you mentioned, reframing ourselves, not just as clinicians, but as community builders, as leaders within our community, and just pouring back into that community that you once lived in. Going back to your old neighborhood, going back to your alma mater, your HBCU, which I pray that is still around. So I think it's just really important and pouring into your community that builds you. And the goal is to, help those who are trying to get to where you're at, and pouring into your community and helping the high schoolers, the mentorship. As I mentioned, I was a former NFL cheerleader. And, when I was younger, no one would have thought that I could be, a nurse practitioner. Everyone thought that, I should just stay where they put me in this box. But for me, it was the people in my community that showed me that, you can be a jack of all trades. You can do it all and be brilliant and be great at it. So I think it's just really important that we continue to use our knowledge, use our power, and advocate and pour back into, certain neighborhoods. Gentrification is real. But I had an Uber driver the other day. I live on 14th Street. And he was like, I was in this area, and boy, it's changed so much. But really, I came back to see my old peoples here. I have a Tesla now, and I live out in PG County. But he mentioned that I came back to show them that there's a way out, and you can do better. And I'm married, and I'm driving Uber, but it's just I do it for fun. I don't do it because I need to. So I think it's just really valuable that we go out into these communities and pour into people and let them know that they can be better and they can do better. And by showing that, it's just showing up and showing them that we've done better and we have been there. And the goal is to really just, use our voice and advocate in that way.
Adjoa, can I add something really quickly to this too? Because we are talking about solutions and it gets really heavy and hard. And you made me think about this, our power. There's this I'm paraphrasing what Alice Walker said, that's what got me out of the bed 2 days after the election. You have to maintain a healthy soul in the face of constant oppression. And so in all of our solution finding and building, joy and rest are just as important. And do not, capitalism in this society is telling us that it is binary, right? That we can only work. We can't also have joy and we also can't have rest. All of those things can happen at the same time. I give the example of, we always refer back to the Harlem Renaissance and what was birthed out of the Harlem Renaissance, right? The great Black artists and visionaries that were birthed out of the Harlem Renaissance. At the same time, the KKK was running rampant and lynchings were public. All of these things can happen at the same time, and they have to happen, particularly in our communities, for us to maintain that healthy soul that fights against the system. So do not forget your joy and your rest in all of this solution building.
Well, that was great. Way to segue into any questions. Do we still have time for questions? Yep. Okay. No one's telling me no. So please come to the microphone if you have a question. But that's really great because I think that even with all of this happening, I mean, look outside, look in this room. There's been so many examples of progress. And best practices and evidence-based solutions that are still occurring. And Dr. Puckrin, our fearless leader at NMQF, is like, we've been here before. What's all this razzle-dazzle? What's all this, concern? We've been here before. So a lot of this unrest is actually cyclical in a lot of ways. I know it seems seems extreme to some right now, but our history shows constant examples of resilience, particularly with minoritized communities. So I think that your point is very apt. Okay, question.
Okay, it's working. So first, thank you guys for sharing all your expertise. I think everything you said is very valuable to everyone in this room, but one of the questions I have is, I know you brought up what can we do within our own personal lives, especially when it comes to engaging our own family. Like just even starting there with your friends and family and kind of, swaying them from that disinformation that they're receiving. How do you feel, or is there any tips that you guys can give us on kind of engaging those relationships? Because a lot of people don't want to touch that. They can hear disinformation from their family, they want to shrug it off, they don't want to get into arguments, they don't want to disrupt the family ecosystem. So what is your advice for folks who want to engage, their friends or their family members and kind of shake them into understanding like this information that you're receiving is not accurate? Even so, like you said, there's people who are paying folks who that are credible sources, who were probably credible sources to guide you to different information that's not actually real and genuine.
I mean, I'd like to share something that is a personal experience. I have a very good friend whose mother was a very prominent and very famous physician. She went down, she had a death during, like pre-COVID actually, and in that time, it was her husband, in that time she went down like a rabbit hole and then became like a QAnon person. And then also was on one of the lists that the government released of the top people who were putting out disinformation.
Wow.
She became the person. And she was a super well-respected physician. And so all of her accolades and all of the sort of, just the credibility that she had really built over years kind of crumbled, but it also impacted her family, right, and her daughters who were friends of ours, and it created like a lot of polarity. And what I will say though is that everyone who was, while her daughters could not speak to her because they were repulsed and upset and embarrassed, those of us who were friends of hers swarmed around her mother. And so we kind of took turns checking in, also providing alternatives, like trying to just be different voices, because sometimes it's not going to be your immediate family members that can hear you. Oftentimes, like in our work, especially like with, you know, in caregiving and in doula work, oftentimes you're moving into a setting with individuals where there's fraughtness between family members. And so you're helping people manage that family dynamic as a non-judgmental presence of support that is neutral, right? And so sometimes it might be like a community effort where other people can come in who also care about them and aren't necessarily as close, right? And I think that that can be sort of like another layer, like the people who are sort of on the fringes. Another tool that I think is very helpful, it's called pod mapping, and it comes from the disability justice movement. And it is an exercise where you essentially have all these circles that are on a piece of paper. You can download it online as an exercise. And you put in each circle names of individuals and people who can show up for you. And you're in the center, but then the people who are around you, you know, based on like how they can show up and also your experience of them, but also in these times of need, right? And when we are searching for information, we're trying to guide people towards solution, like we're in need, right? And so it's a really good exercise to do prior, right, to needing the support. So you build up community and you build up the resource of community in advance of having to activate it. But it's a great tool also to think about, like, who are those folks I can call upon that will also, my mom will listen to, right? Or my grandmother might be able to hear it from. Or my little sister might, you know, vibe better with, right? And activate those people at that time. And so I think that how we also do sometimes are like group chats, right? Where it's like a WhatsApp or whatever, where we can dump in information or a study, or even finding ways to break things down so they're snackable for people. Because to Joelle's point about the social, like people can maybe watch a 2-minute TikTok, but maybe not read like a 40-page report. And so finding those kind of ways to make it easier, but then also activating your community to kind of be other voices, I think can be really helpful.
Thank you.
Yeah. I just really quickly want to add just like 3 things from like the public health aspect of like ways to combat misinformation that's out there. So one, I think I have to say consistency. Because it's not going to take one conversation, right? It'll be multiple conversations over time from different sources. And so those trusted sources are great places to also put pressure and allow people to just not see it from one angle, but other angles. 2, when someone repeats misinformation, not repeating it back, but starting with the truth, and then maybe getting to the misinformation and saying why it's wrong, and then coming back to the truth. And so never letting the untruths that are out there sit, but then reframing it. And then 3, approaching the person with love. I think especially in this climate, it's hard to do that sometimes, especially if you don't agree. But I always say seek first to understand and to be understood. And so first understand where they're coming from. I feel like so much misinformation comes from kernels of truth that do exist out there, but it's the truth that's been twisted to apply to something else. And so understanding why someone believes what they're believing allows us to better insert the information they need to find the truth.
Thank you. That was great.
All right.
So I have a couple questions. I hope you'll humor me for a second.
Yep.
I look at a lot of the things that are happening right now in America from a historical perspective, and so I want to go from that angle and ask you a couple questions. The first is, I'm going to offer a couple of quotes. FDR, in his inaugural address, said that plenty lies at our doorstep, yet a generous use of it languishes in sight of the supply. And Martin Luther King Jr. said when he was accepting his Nobel Peace Prize that there is a second evil which plagues modern society, and it's that of poverty. Many of these poverty-stricken children of God have never seen a physician, have never seen a dentist. Poverty is not a new concept, but the resources to be able to solve it is a new phenomenon. And so I'm curious what your thoughts are on the role of poverty when we look at health inequities, whether it's across the socioeconomic spectrum. The second is that the United States has looked at landmark healthcare reform for over a century. Since the 1910s, 1920s, we've talked about insurance or healthcare. We've debated whether it should be provided as a national public good or insurance. And I'm curious about your perspective on whether that structure needs to change. To me, it seems unsustainable in the current form. And then the final question is, I look at all of the cutbacks. You talked about Roe v. Wade. We talk about DEI rollbacks. We talk about voting rights rollbacks. Are we in need of essentially a second civil rights movement or a human rights movement in the United States?
Okay, so what was your name, sir? What was your name?
Adam Alvar, I'm the policy director for the Hemophilia Federation of America.
I appreciate you. I think he just asked all of y'all's questions. What? Okay, so maybe I wrote down the questions if you needed to remember, but one was, what could health reform look like? Are we in need of health reform at this time? Does anyone want to take that question?
I mean, I just think we all would say yes. Yes, fundamentally. But again, this is why storytelling is incredibly important, because there's so many conversations around, also misinformation, disinformation, the fact that so many people still don't understand the difference between the Affordable Care Act and Obamacare, which is, that just tells us, it's also the reason why they're gutting our education system, but that's a whole nother piece of this. The storytelling around what the Affordable Care Act and or Obamacare, however folks want to talk about it, as well as Medicaid and Medicare and all of these, what we do have and what is working and what is needed, I think that will help us shift culture so that we could hopefully get elected leaders who, instead of talking about healthcare for political gains, they're actually talking about it to find solutions together, right? It shouldn't be a partisan issue. It should be something that folks across the aisle work together and fundamentally transform our healthcare system. And so yes, I think we all agree that yes, it needs to change. And the way that it does is we have to really talk about the people who are the most impacted. And we've seen frustrations of folks with the healthcare system and how, unfortunately, if this country doesn't get it together, it is going to become even more dangerous for people, right? And so, yes.
Right?
Yeah, just seconding that. I think we've all heard the facts that the United States spends more on healthcare than any other developed nation, but we receive less when it comes back to it. Yes, the healthcare system needs to change, but the question is what does that look like, right? And I think it looks like something that doesn't exist right now at all. It's a reimagining of it. Is it value-based care that exists? Is it the Medicare for All that exists? Is it a blend of a Canadian system with a different system that's out there? And I don't think anyone has the answers, although we'd be implementing that right now. There wouldn't be so many of this conversation. Then it's also the fact that we have every state that's different, right? It has different services within there. And so for me, I think about this a lot. I have a podcast called The Dose, and I try and interview people exactly about this. What would an ideal healthcare system look like with all these different moving parts when we have payers and payees, we have insurance that exists, physicians, we have reimbursement rates that are set at different places, we have a lack of transparency when it comes to not being able to even know when you go to the hospital what you're going to be paying at the end of the day. There's a lot that needs to be fixed. And so the short answer is yes, there needs to be change. Yeah. The long answer is what does that look like, and having to literally go through every single itemized list of all those things. And that's actually what got me interested in medicine in the first place, was having personal experiences with family who went to the hospital that weren't getting transparent care and wanted to come and actually fix the system. And I knew that for me to fix the system, I needed to go through it first as a doctor, then to practice, and figure out where the pain points are. So hopefully, we'd love to talk if you have ideas as well about where does this go, because I don't have an answer, but I know I want to be a part of the solution.
Well, and then also figuring out our healthcare system will help us figure out the solutions to poverty, right? Because we know that the majority of debt that people hold is medical debt.
Exactly.
Right? And so these all are, which actually kind of leads to your third question of, is this a human rights reform, right? All of these issues are connected, and we have to do a better job of connecting these dots, connecting poverty to healthcare and housing, all of these different things. And so as you were talking about that, it really made me think about all the work that we used to do when I was working for Senator Elizabeth Warren, connecting healthcare and poverty directly. And as we start, if these stories unfortunately don't move elected officials, then we've got to actually, what'd you say?
Well, they believe poverty is a moral dilemma.
They
right?
do.
And so
Yeah.
I think if we don't look at it as a systemic failure, then we're not going to look, because we literally have the social determinants of health, which help us understand how non-medical factors contribute to and impact our lives.
Absolutely.
And obviously, like how race and poverty are lived, how when we look at intersectionality and health outcomes, like all of these things touch one another. But if we see it as these people inherently deserve to live this way and also be unhealthy because of a moral failure, like that doesn't change whether or not we have access to better care. We're not going to put hospitals in neighborhoods that deserve them because we believe those people should die, right? And so I think that that's the issue. But you know, when we're thinking about how to design something better, I think it's like people who are in this room who help do that, right? And so, I mean, I think it comes back to like all of us understanding that we do have the solutions, that we need to sit down and figure out how to design something different. And yes, it is like doing something completely new, like we've been saying, I think, which is like thinking about some people as builders and some people as folks who deconstruct, right? Like, so demolition, right? Like what side are you on? Are you someone who builds or someone who likes to tear things down? I'm someone who builds, right? And so and maybe there's different times in your life where you're on that side of building or on the side of, you know, tearing things down. And I think that we need people to deconstruct things so that we can, you know, analyze them, like do an autopsy, understand what has happened, figure out how to do it differently, but also figure out how to get it out the way. So that as we're building something new, when this whole thing falls apart, people have somewhere to go because we're building it. And so we need people who are like, hey, what does the future look like? How do we design it? Like, who are the people that are going to invest in that, bringing those people to the table? Who are the folks who are going to live into a new vision? Like, those people have to be at the same table. Right? And so half the time we don't know like who those people are. Like we don't understand what side they're on and like what role they're playing. So I think part of the community building is about that, right? Like figuring out where you sit within this ecosystem of design and how you're going to design something differently.
Yeah, I think the last thing I'll add is I'm working with the UN right now on a campaign that they're doing about what's called the human rights economy. This way of reframing how we think about what the economy could be in the United States. It's moving from thinking about GDP as one of the things that we want to think about in a nation to quality of life, you know, profits to people. And I really like this campaign because it's about restructuring the entire system to focus on the moral dilemma the problem that we have right now, and thinking about human rights as a core issue that every country should be measuring. You know, if we, unfortunately, we measured that in the United States today, we wouldn't be doing very well, right? We'd be sliding in the opposite direction. But I'd say maybe like check out what the UN is doing there when it comes to trying to get this idea of the human rights economy out a little bit more, because I think it falls in line with a lot of the things we're saying right now in ways that we keep moving the country forward and literally reimagining an entire system.
Yeah, I think it's really important what Joelle is saying, because actually all of you have massive capacity to be talking about how we're measuring healthcare differently, to recognize the realities of these communities that we're in. At NMQF, we're always talking about zip codes, healthcare at every zip code. And to your point about poverty, it's astonishing how healthcare can look very different from one zip code to the next. And we know that that is due to a lot of history. But I will say though, Latham, I think that even with the work you're doing, when you're basically employing people by training them to become doulas, that is part of that community building that we're talking about, because through employment, right, we're also impacting the system by having people who come from the communities that they're working in, you know, being represented in the care. And if we have, I see the line's long, but if we can get to maybe there was one question that got a lot of do we need another human rights movement right now? Civil rights movement. Thank you, sir. Do we need another civil rights movement? And what does that look like?
Yeah, that's right.
Well, what it looks like is it can't just be black people on the front line. Right? Because we are so often those at the closest to the pain end up being the ones that have to find the solution, but yet it is life or death for black people, which is why, when there was big protests the other weekend, folks were saying, well, why are black people not out there protesting? I was in Mobile, Alabama, and actually on some ancestral land. Like, it was actually a beautiful time, but the reality is for black people in this moment, when you get the president who is literally talking about martial law, it is literally life or death. And so in order for a movement, it needs to be more than a civil rights movement, it needs to be a human rights movement. And it has to include everybody. And those with privilege have to be the ones that stand in the gap. The other piece of it is, to this point we're all talking about, we've got to start doing a better job of empowering people who feel powerless. I always go back to this number in the election. Everybody talks about who voted for which candidate, all of that. I look at the fact that 90 million eligible voters did not vote.
Yeah.
For me, that is an opportunity.
Right.
Because back to this conversation of why, getting to the understanding of why people didn't, go to vote. There are a lot of reasons. That's an opportunity. So if we look at people as an opportunity to give them the power and say, hey, people power can overthrow all this money, can overthrow all of these platforms, then we can really build an intersectional movement. The reason that Fred Hampton was such a threat is because he was organizing more than black people. He was organizing women, immigrants, low-income white people.
Right.
And that multiracial, multi-generational coalition, as Latham started out, that is what folks are scared of, because the reality is all of us together is the majority. And so if we go to the vein of having another massive movement, there's enough, as we talked about, history out there to understand how black organizers have done it. We need more people willing to risk a lot, to spend their privilege. I have a whole chapter on it in the book, spend your privilege, in order for that to happen. And we cannot just let the burden continue to fall on the people who continue to show up, because it is life or death for them.
Dr. Pucker. Dr. Pucker?
Yeah, so I'm actually violating one of my core principles at the Monday evening town hall meeting, which I never come to the microphone.
Well, this is a very special moment, yes.
Yeah, but I decided this evening, particularly with the guests that we have, that this is an important conversation and I should stand up and say some things. So I love the historical reference. Everyone knows my thing is history. And I just remind us, we have a social contract. We don't need a revolution to implement our social contract. We need to live it, right? I mean, let's be real about that. America is a middle-class democracy. We have allowed the gross domestic product of the United States to fall into the hands of oligarchs. Let's be candid about it, right? You've got 2% of the population owning 90% of the wealth. 50% of the American population has 2% of the national wealth. That wasn't envisioned in our social contract. There is no oligarch in our social contract. We are a middle-class democracy, and we need to act that way. And we're not acting that way. Right? So that's item number one. So we don't need to go get some new theory of social organization. We have one that we've lived with for 300 years, right? Now, every once in a while, you get these aggregations. That was the progressive movement in the 1890s. And the progressives said, okay, we've had enough of that with the robber barons, but they've come back. They've come back, so we gotta go deal with that. So that's item number one. Number two, you have to think of information and the logistical system around which information is carried. Part of the problem that we're having right now is that we are not managing the logistical system that carries information into our communities. So we are allowing people to populate disinformation and misinformation into our community, which is completely destructive. And it's intended to be disruptive. This is no accident, it is happening.
Right.
So part of what we have to do, and this is the reason why I stood up, because we have all of these social media folks, we have to collaborate and build an information system that carries information into our community, because that's the only way to control the disorder. And that's what it is, it's disorder that is keeping us poor and stupid, and now threatens our very lives.
That's right.
I'm being honest.
Yeah.
Right? I'm old, I can be honest. You know, I've done my time here. I can communicate to you in a real way, right? And so, at this very moment, what we need to think about is the information system that we need to build in order to deliver information into our community. So I'm not telling you social media to get off of the TikTok platform, Facebook, whatever you're doing, but I'm saying to you, it's also got to be connected to an information system, because Elon Musk ain't going to drive it for you. I mean, I'm sorry, he's not going to do it for you. The Chinese on TikTok ain't going to do it for you. I mean, come on, right? The Chinese are not going to do that. Jeff Bezos isn't going to do it. So the road forward is pretty doggone clear. That we have to come together and build our information system that touches every part of our community. I want to say two things, because she brought up zip codes, I have to say. There are 40,000 zip codes in the United States where people live. 70% of African Americans live in 2,500 zip codes. America is completely segregated. Woodrow Wilson set that up. Those zip codes were set up deliberately, right? The Hispanic community is also in about 2,500 zip codes. So the point I'm making to you is, reaching those geographies ain't as big a deal as you think it is.
Right.
Right? And so, what I love about this moment is the disruption. Because that disruption means opportunity, because we needed to get the debt reshuffled. I'm sorry, that debt was flawed. It was built to keep us down. It was, I mean, you know, particularly healthcare. The healthcare system was built during the era of segregation. Right? And it's doing what it was built and designed to do. You know, it's doing that, okay? So, and I'll just say this finally, because I always think that this is an incredibly important moment. For 300 years, we were slaves. The best and the brightest in our community, Frederick Douglass, Phyllis Wheatley, all of them, the Negro Convention movement in the 1830s and 40s, they spent every waking day trying to get out of slavery. That's what they did. While people were building empires, making money off of our enslavement, the best and the bright in our community were trying to get out of that doggone thing. We get out of it in 1865. By 1874, we're living in a world of segregation. We're virtually enslaved again until 1965. The reason why I'm giving you that little bit of history, because you're saying the right thing. We have to build sustainable, healthy communities now. We have to define the reality that we want to live in. This is our time. This is what generations strove for. to give us this moment in this room to decide what we want to live in, and who do we want to be, and who do we want to hand the next generation to. So it's a building exercise now, right? And the way you think about building, you think about logistics, logistical systems to carry resources, information into our community to help them build. We've been in, with Adjoa, we've been in the 5th Ward in Houston, Texas. It looked like a damn bombed out zone.
Yeah.
I've been in Selma, Alabama. It looks like it was left in the 1950s, some damn place.
Yeah.
I go to Flint, Michigan. It's like, what the hell? What the hell is this?
Right.
We got 48 members of the Black Caucus. I'm sorry, the Freedom Caucus is only 24, and they're raising more hell than anything. Okay, so anyway, I'm on slow down. Because I'm saying to this group sitting on the stage that you have a really incredible moment to play here, to help us think through how we take the great work that you're doing. And I would add in the National Medical Association, the Association of Black Cardiologists, churches. Everybody's got a website, but it's not linked.
You're right.
It's not talking to each other. It's not driving information. That's the moment, right? That's what we have to do. So I'm sorry I violated first principle tonight, but I could not allow you to leave here without saying that.
Well, can I? Since Dr. Cochran put the football in our hands and we're trying to run it through the goal, and so can we get an agreement from all of you folks on this stage that we're going to build this information system, we're going to collaborate and connect our knowledge and our resources? Can I get a hell yeah from you guys?
Hell yeah and amen.
Hell yeah?
Let's say
Okay,
amen.
it's on video, it's live streaming. Okay, and what about you guys? Can we get a hell yeah from the audience that we're gonna work together? Okay, I like that. Okay, so Latham, you had one quick thing to say before?
One quick thing to say, yes. I did want to just acknowledge the social media is a powerful tool. We actually develop IP, right? And so at Mama Glow, we have developed market-leading training programs, and also a really great example of what you were talking about is with CVS Health Aetna, we designed a nurse care manager do a competency training so that nurses could go into communities, particularly communities that have been underserved, to bring resources, and particularly the work that we're doing into those spaces. We designed it for CEU credits. We also did it for MCs, for doctors. And so, and we did this nationally. And so to me, it's about us also owning that IP, because that's our curriculum that we deployed to CVS. We also developed a website, which is actually launching really soon and won an award. I can't talk about the award yet, but we designed this website for them, which also contains a shared decision-making tool, which we also designed, and that will be used by all of their nurse care managers nationwide with their patients. And so it'll be downloadable and mobile accessible for patients. So these are the types of things that are possible, but I think we also have to own our resources. We have to also own the educational tools. We have to own the technology. We have to design. So we did all that ourselves and then license it out, or we develop it like fresh for people from scratch, and then do everything from implementation to UX, UI, everything. And then we also get all the data capture, and then we report out. And so I think that I'm on social media too, but we're literally designing solutions that we can bring into the marketplace, and then also take that information and figure out how we can, outside of like the sort of hub of CVS Aetna, then see how we can like replicate it other places, right? And the people who are being touched are like us. So we're really proud of that work, but I think it's important to kind of like find the ways to touch all of the services, right? And make sure that we're also bridging some of the care gaps and reaching for us, it's important, those nurse populations that do not get this training, and also a lot of physicians come take our training. So those people are also bringing these skills inside that are impacting our community, especially when we think about like health and Black maternal health equity specifically. So I just wanted to add that.
No, I'm so glad you did, because that touches on the theme of this summit, which is from data to action, right? So when Dr. Puckman is talking about information systems, he's not just talking about social media or our websites, he's talking about our knowledge, our data. I hope you guys tried our chat NMQF, shameless plug here, which is basically a way for us to access the billions of patient records that we have here at NMQF, but it's also designed to really be an access point for so many of the patient advocacy groups, because you need that data to do the truth telling that we've talked about tonight, because there's a lot of misinformation, but it's really hard to deny real data and facts, following the science, as Dr. P likes to say, but also, you know, when it's backed by real people, as you all have mentioned on this panel tonight.
I just wanted to say one last thing just off of that. It's also about teaching that to the next generation.
Yeah.
I think I want, so one of the projects I'm working on is called The Doctors In. It's an online TV show for kids to be able, for 3 to 8-year-olds, to be able to watch and imagine themselves in these positions. So I think also making sure we extend these pipelines and start early. Right. I haven't heard that enough, like starting as early as possible, already with the next generation, so we're set up for success.
I thought we had one more question, but I think she's disappeared. I don't know. Okay. All right. So maybe we'll close. Is there just one last thing that you want to leave with this audience when we're thinking about influencing healthcare? We talked about the change that we want to see. Is there anything that you all want to leave as sort of noodles or things that anyone in this room could do starting tomorrow? And I'll start with you, Jess.
We never spoke on AI, but I think that's something that is a great topic and discussion that we can start using technology, and using that as a resource for information and teaching it the right things so that we can kind of populate that.
Right.
A lot of people are using AI, so that's a conversation starter that needs to be implemented. So I think that's something that is the future, and we need to utilize it to help with a lot of our health disparities as well. So
That's an awesome point, yes, thank you.
I think the last thing I'll just say is, as we're finding the solutions, understanding that we got to remove ego a little bit out of it, because so often we want to be the one that finds the solution or has to go our way. But if we are all at the table and know that our final destination is the same, it might be your path that we're going to go, and that's okay. So we got to remove ego from this a little bit in order for us to get to where we are going. And removing ego does allow for that grace and embracing of this new technology, the patience that we need. So yeah, we know the accolades we all got, okay? But we also know that there are people in the communities that we are trying to help. They actually have solutions that will work for themselves as well.
Amen to that. Yes, someone said earlier today, I think one of our 40 under 40, that patients can teach clinicians.
Yes.
It really is a two-way conversation if we're talking about truly influencing health. Thank you so much for that, Alencia. Joelle? Yeah,
for me, it's picking up on what was said about the ecosystems. So coalition building, finding the ecosystems. The other side does have ecosystems right now, disinformation networks.
Yes, they do.
That starts with social media often, and so I'm very honest about that social media is used. But then there's the podcast network that exists out there too. It then goes to news, Fox News. And then when you get those 3 different ways of that information being out there, it sticks. And so finding ways to have truth tellers and create our own ecosystems that tell accurate information is really important. And then related to that, making sure that we're not just faceless bureaucratic institutions, but that we're being intentional and are putting trust in actual people that can be seen. I think that's one thing that's missing right now that we had before.
Extremely powerful. Thank you so much for that. Latham?
Yeah, I would say please pour into young people, mentor, find people that you can support. And then I would also say, since you're here and you have another day here, make sure that you leave with like a group chat, like connect with some people who are doing similar things, that are like facing similar problems, that are trying to tackle some the same solutions, and just stay connected and take care of each other, because this work feels siloing sometimes, right? We sometimes feel like we're alone, but we can do so much more if we move together. And so hopefully you'll leave out of here and you have some new friends you can hang out with, but also people who you can stay in the fight and stay fortified as you continue the work.
Thank you so much for that. Stay the course is the message, right? Let's be consistent with our messaging in order to influence. Let's work together, collaborate. Let's build our own ecosystems in order to build a new civil rights movement in healthcare. Thank you so much.
Thank you, beloved.
Thank you.
All right, hey folks, it's Brandon. So I'm not stopping anything right now, but I just wanted to let you know that we will be going to if you're so inclined and you want another beverage and to keep the conversation going, we're going to be at Blue Willow on the 3rd floor after this. So